Good morning and welcome to Community Conversations. I'm Vicki Green. It's Heart Month, and I'm not talking about just Valentine's Day, though love and compassion are the name of this game of what we're talking about today. I'm going to start today's show off a little bit differently than I usually do. I have two guests in studio, but I'm going to have my first guest tell her story. Alicia Bousquet-Taraziak. Thank you, Alicia, for being here. I appreciate it. And you are a heart disease survivor. And so we're going to tell your story because it's, I think, a story that a lot of people listening can relate to. And with you is Blair Young, who's a senior director with the American Heart Association. Good morning to both of you.
Good morning.
Good morning. Thanks for having us.
Oh, you bet. So, Alicia, you and I had a chance to talk on the phone, and I didn't realize how fast the time went because the story is amazing. So why don't you start with, from the beginning, because I think a lot of people listening, when we get to the numbers, as Blair has said before we started the show, a lot of people listening either know someone with heart disease, know someone that's had a heart attack, has a relative or a friend, even children. So we're here for those people listening so that they can hear your story, and maybe they have relatives or family that sometimes people don't take it seriously. Mm-hmm. You know, they might feel pain and say, oh, that's not a problem. So why don't you tell me how it started for you?
So I was born with a heart disease, or a hole in my heart, actually, that was corrected when I was 8 months old. So from there, we had the surgery. It was successful, and I lived a happy childhood, very healthy. And I did go for follow-ups annually. It's just like a regular doctor's checkup at the cardiologist, and I was, clean bill of health. And again, my family just would know that was part of my upbringing, but most other people didn't know. I mean, you can't see it. It's, I had a open heart surgery at 8 months old, and no one knew it unless I told them. So
did you prefer not to tell them?
Yeah.
Because you wanted to just be a regular kid?
I did, yeah. Honestly, it just wasn't something that we talked about. It was people that knew me from growing up, or my family clearly did. But, we just went to the doctors annually, and everything was good to go. So we just moved on with our lives. And then as an adult, I had to take on that responsibility of my own, is, finding the right doctors and making sure that I was continuing that ongoing health check with the cardiologist. So from there, I did find a local cardiologist versus being seen in Boston still as the pediatrics that I was.
So you were seen at Boston Children's?
It was Tufts at the time.
At Tufts, okay.
Yes. And so that was being followed by them for years, obviously, as a child, and then as an adult you change doctors anyway. So when I did start seeing a new doctor, that was going fine in the beginning as well.
And you were in your 20s?
I was in my 20s,
okay.
Early 20s by the time I changed. And then I did start to have different symptoms that I was concerned with and that other people were concerned with, and said, maybe you should just check with your cardiologist. Even my primary would send me to the cardiologist when I had certain signs and symptoms.
What were the symptoms?
Yeah, I would get very, at times I would pass out or have feelings of passing out, difficulties breathing, swelling of the feet, and so at different times, very, very random, not often. It did not happen every day. I was very healthy. I was extremely active. I worked out all the time, never smoked. And clearly, as we already know, is heart, you want to look for those signs anyways. I kind of knew to look for that a little bit because of my history, but as of course, going to the cardiologist, bringing those signs and symptoms to them, you need them to make sure that they're doing all the checks within the necessary tests. And for years, I kind of struggled with that. I didn't understand my condition or why it was happening, if it was heart-related or not.
Because you had been fine. You had no symptoms for 15
years. I had been completely fine throughout my young years.
Yeah.
And then in my 20s, and again, I was very, very active. I was very athletic. Ran cross-country, ran miles a day,
Wow.
Worked out all the time. And then just like I said, the symptoms just came on randomly. There was no rhyme or reason all the time, and I would just have to know my body to stop. And the doctor's like, well, just stop and sit and, relax. But it didn't give me answers. Like, I didn't know why it was happening. I didn't know what the condition was. Like, was it heart related or not? She wasn't eliminating that.
And you were passing out, though.
I did pass out a few times.
That's scary.
And I would get lightheaded a lot, or at least have faint, I call them episodes. So when I wasn't getting answers from the cardiologist that I was seeing, I said, you know what, at this point, I really got to advocate for myself. I was in my 30s at that time.
So you let it go for 10 years,
I
so
did.
people
I was
understand.
going
With
back
this
and forth.
doctor that
and
you...
that's a no-no. I know that now. But as a young, you go to the doctors, you listen to what they're saying, and they say that it's not heart related or you're fine, then you walk out the door. But it continued to happen, and I still wasn't getting answers. And my biggest thing was, at that time, I didn't realize that there was additional tests that could have happened. And that's on me. I didn't educate myself enough to understand, like, excuse me, push that doctor or ask for those different tests. My family too, they kind of just trusted in how it was being handled, and the in-office checks that we had, and we just kind of trust in that. Where the turning point was, I stepped off an airplane a couple years ago, and my feet were so swollen that I couldn't even walk. I had to literally sit myself down.
Oh my God.
And
you don't normally hear a feet flare, do you? Is that edema? It's just a swelling of a... You normally don't... I know you're not a doctor, but you don't normally hear
that's
feet
a
as...
symptom.
It is, for women in particular?
men, yeah.
And men, okay.
So that was a turning point for me, because it was pretty severe at that point, where my feet were killing. They were coming out of my shoes. So
Oh my goodness.
it was scary, because again, I don't know if it's heart related, but the cardiologist I was seeing kept, not going those extra steps to see if there was anything going on with my heart, or causing these circulation problems or anything like that. So I didn't know exactly what was going on. So at that point I said, all right, I'm just going to go get a second opinion, another doctor, see where we can go, and finding out why these symptoms keep happening randomly. And so my thing is, it's not that I was born with a heart defect, but also there could be underlying issues that weren't identified.
Right, and just because we want to make the point too, being born with a congenital heart defect happens to a lot of people. But that's not just what a heart attack or heart disease is
Correct,
about.
right.
And you knew, if anything, the surprising thing to me is that you grew up with that, and so I would have thought in the back of my head, all of my life, luckily you weren't thinking that way, but all of my life I need to be watching myself.
Yeah,
I need to be careful. But you're in your 20s, you go to a doctor, like you said, you trust a doctor. Now, I don't want to give away your age now, but you spent 10 to 15 years with a doctor that ended up being not helping. And in that time, you got married and had kids?
I did. I have a daughter who's 6 years old. So at this point now, we just passed a year that I'm with a new doctor, but an important reason why I was changing was not only that the test, and I wasn't understanding my condition, or I didn't feel that she was listening to me. I didn't feel as if she was taking those extra steps to really understand me and my condition, my signs and symptoms, and as a person. And I was scared. I'm like, if there's something underlying, I want to prevent it from getting worse, or prevent a heart attack.
So your blood pressure, the other symptoms?
My blood pressure is very low. Like, it's usually low. Usually when I
But
go
if you're
to
a
the
runner,
check-
isn't it low
Exactly.
anyway?
So that wasn't really a concern, because it is low, but it's something that I'm healthy. So they think of that as a good
That's what I'm
sign.
saying. Blood pressure, cholesterol, all the typical symptoms, you were okay.
Yes. The right. So in last year, I went to a new doctor, and from there, it's been quite the year. First of all, first appointment, I was very emotional, because I started to understand the connection you can have with a doctor to really care about you and help you. So I found Dr. Hadley at St. V's, and she's been truly amazing and really out for my best interest. And she wanted to get a baseline. She said, okay, well, let's look back in the history. However, we can do that, but let's see where you are now. Let's get a baseline.
So she did a battery of tests.
She did, and so she did start with your typical cardiac-related test, which is EKG and echo.
Stress tests?
Yeah.
Where you walk on the treadmill?
So I did do those too, but only after the
Oh,
echo, there was some signs that she had seen some concerns with the echo, that then brought another test that they went down my throat with a scope to check on the size of my heart, which was also another issue, that they saw some enlargements.
Were you upset that this wasn't found
I
on?
was
You had to have had
angry. I was
yeah.
angry in the beginning. I really was. When I first started going through these tests and finding some defects that, may or may not be major, we don't know. But in going through these series of tests and results that were, some were good, some were positive, some are not good news. I was really angry to say, I've been saying this for years. I've been wanting to at least understand what's going on and if there is a baseline to go by. So I was really angry, but I have to move forward. I can't hold that, into my heart, because I really just got to move forward from here. I have a daughter. She's really important to me. She needs her mommy. I want to be positive as possible, and I'm trying not to be a negative person anyways. I try and be positive.
No, you're very positive, because when I first talked to you, I thought, oh my gosh, you're laughing your way through this.
Yeah.
But at some point, some people laugh kind of, I know I do sometimes, as a
When
mechanism
nervous and, defense,
because it's not an easy thing to talk about. No. But I'm so glad you're here today to talk about this, and that people need to question their doctors. Now, before we finish, because you're here, so you're getting good care right now, and I think one of the things you told me that's excellent is that the communication is really good. Yeah. Even if there's tests that are up and down, which has been difficult for you, you said. Because you'll get good news and bad news, but as far as you know right now, everything's okay, right?
No surgery or anything.
No surgery needed. That's excellent. Very happy, and I'm sure your family is. Actually, before I get to Blair, one last question, because I have a daughter who's older. But how do you tell your daughter, you might have to call 911. How old's your daughter?
She's 6.
6. Okay, so how do you explain this to your child? Because people listening might want to know.
Yep, we did actually. She came to the doctors with me a few times. They checked her, and so they know her in Dr. Hadley's office. The team is amazing. But I have let her know that, going through all these different appointments and tests, I was, very emotional at the time. But she knew that Mommy had to go to the doctors, and that if anything ever happened, she knows the number to 911, and she actually has my code to my phone. She can call anybody she wants. So if you get missed dials, that could be her. But yeah, she's a really, really sensitive little girl, and we have a really good connection. So, I do want to be honest with her, and I want her to know that I'm here, and my health is important, so that I can be here for her, and her health is important, because obviously I would be doing this for her.
And she was born without any heart issue?
We did have a prenatal check and then a post. So she does not have what I have, so that's good.
And I think when you expose your kids, she's probably not as scared to go to the doctor as
she's
some
not.
people might be.
No, and she's come to the heart doctor with me, and she loves them. They're great people.
That's amazing, and I think it's so important to start kids early so that they're not as worried as you grow older, and I'm sure your husband is there too. But I've had experiences with kids, with parents, with my own daughter. If something happens, they get scared, but they don't. If they're older, they don't want to tell you that. Oh my gosh, what if something happens to mom or dad, and I have to call 911? They don't want to say that, so they keep it in, and that's a tough thing. So I think the earlier you start talking, the better. So, Blair, when you hear Alicia's story, what's important? I mean, the fact that she changed doctors, are we seeing, even though we're in Massachusetts, the great area of, medical education, academia, healthcare, even in Massachusetts, you think there's a lot of things that still can be done to better educate doctors and the public at large?
Oh, absolutely. But I will say, though, that the American Heart Association has spent $3.9 billion in research
nationally
over the past 50 years, and that's more than any other entity outside of the federal government. And that makes a huge difference. Some of the stories that I hear would have an entirely different outcome if they'd happened 10 years ago, 15 years ago. And the local board of directors for the American Heart Association has a number of neurologists and cardiologists on it, and they regularly hear presentations about the latest science. And we fund $2.1 million annually here in Worcester.
$2.1 million just in Worcester?
Just in
Worcester County or the
UMass
city?
Medical School and research. And so we just had a reception over there where some of the researchers talked about their research, and it's eye-opening, the things that they are working on now that will save lives next year and 5 years from now and 10 years from now. But the education part of it is the preventable side. And so a lot of what she said is important in that we need to know our numbers. We need to know our blood pressure and how it changes, and our blood sugar and our cholesterol, and we need to know and keep track of those and monitor those. There's a self-assessment that the Heart Association offers free to anybody. It's at www.mylifecheck.org.
Mylifecheck.org.
You can go on there, create an account, answer 17 questions about yourself, and you get a score, your heart score of 1 to 10. And then
We don't want to scare anybody, though, so it's a pretty baseline.
It's a baseline. It tells you basically how healthy you are, and people often think they're healthier than they
That's
really
right,
are, and
yeah.
so it's an eye-opener. But it also starts giving you tips and suggestions on how to manage your risks. And in my case, it's going to tell me I've got to walk a little more and lose some weight. And so as I do that, I can change those numbers. Now I'm walking, 5 miles a week, and I've lost 5 pounds. So I enter those numbers, my heart score goes up. And so people can monitor their heart score.
And the Fitbit and the
Oh,
watches.
that's
Yeah, I was
another
going to
thing.
say.
I have one,
Right.
and
That helps
really
you?
does help.
Yeah.
Mhm.
Yeah, so you can start monitoring your progress towards a healthier lifestyle. And so, and then recognizing the signs too. You can prevent heart disease by eating right, exercise, managing your blood pressure, reducing sugar, reducing salt. But you can also do things to recognize the signs so that you get care right away. So that the longer you wait to ask for care, call 911, then the less likely you're going to survive and survive that.
And that brings up 2 points, because people do hear, are the symptoms different in women than they are in men?
Yes.
Is that why, and do women, I know the numbers seem to be higher for women. Is it because they just push it off, like Alicia said she did for a while, and just say, oh, that must have been just an episode, I'm fine?
Yeah, so I think a couple things are at play. One is that typically we think of heart disease as being an old white person, old white guy's disease, as opposed to it impacts everybody. And the symptoms are different. You think about the pressure in the chest, whereas women it might be tightness in the jaw, or tightness in the shoulder, or feeling all of a sudden overheated.
And nauseous,
or
I read.
nauseous or dizzy, all those things.
And we're not saying every time you're nauseous to panic, but
But
if you
to pay
have
attention
multiple
to that.
symptoms.
You can't,
yeah.
right, you can't ignore the signs, and so if you're nauseous, there's a reason for it. And if you just ignore the reason, then that's putting yourself at risk. And so we try to talk to people about understanding the signs and reacting to them, and then on the education side, reducing your risk by doing all the things you're supposed to do in a way that's going to make you healthier.
But they're also educating doctors. And the other thing we talked about was CPR, number one, and number two, what's happening with CPR and what the American Heart Association is doing as far as what do they call the machines, the defibrillators
Yeah, the
that
AED,
now are
automatic
being
external
put in
defibrillator.
schools and public areas. And there's been a lot of discussion in the news over the last couple of years because of the expense and were people going to be able to do it. Can you update us on those two?
Yeah, so the sudden cardiac arrest is what kills people more often than not.
Right, your heart just stopped.
It just stops, and so you're talking to somebody, or you see somebody, they just go down. They're not responding. They're not breathing. That means their heart stopped. And so the quicker you get help, the better. And the first thing you do is to start doing what we call hands-only CPR, which is
So
using
not the
both your
breathing,
hands,
just the
no
hand.
breathing, just putting your heel of your hand right in the middle of their chest, putting your other hand on top, locking your elbows, and using your whole upper body and pushing as hard as you can, about 100 times a minute. Think of the song "Staying Alive" by the Bee Gees. And if you're somewhere,
So you can, yeah.
that's the beat.
I'm
Staying
singing it in the
alive.
back of my head. I
Yeah.
wish we had it on.
And so,
here, but
if you're someplace that might have an AED, an automatic external defibrillator, you see them on the wall. They got a heart with a lightning bolt through it. Schools have them, businesses have them, government has them. Send somebody for it, because even if you've never used one before, they're made for people that have never used them before. As soon as you open it up, it starts giving you audio instructions on what to do.
Oh,
Where to put
really?
tells you where to put the pads. It has a diagram on the pad.
by audio, it tells you
Audio.
open this,
Immediate-
do
As
that.
soon as you open it up, it tells
I've
you
never
exactly
used
what
one.
to do. And it tells you where to put the pads. It tells you how to do it. It does a diagnostic. It literally diagnoses the situation. And if a shock is called for, then it tells you to push the button. You can push the button all you want, and it won't shock. And if it doesn't call for it, it won't shock. So only when it diagnoses a situation where a shock is needed to shock the heart back into rhythm will the shock work.
Because you hear of that on athletic fields. I mean, it's been in the news last year a couple of times.
Right.
I hear about football. Like, it's coming to my mind, a couple kids were on the field and went down.
Right.
And
If they're
they
hit,
brought one out.
If kids are hit in the chest with a ball hard enough at just the right moment, it'll stop their heart.
No matter if they're healthy or not.
Doesn't matter.
Right.
It's that stop. It stops the electronic. It's an electric beat, so it stops that electric beat, and then the AED is designed to shock the heart back in rhythm. But the CPR is designed to keep blood moving to the brain, where brain cells will die without oxygen until the heart gets shocked back into rhythm.
So
you gotta do
everybody
both.
should know CPR.
Everybody should know CPR.
And you would think everybody does, but from talking to you before we went on the air, you're saying that more of that needs to happen, more educate. Because I grew up. Now they have babysitter classes for CPR. I babysat without CPR. I mean, but now parents are looking for that. They're
Right.
saying, I want to hire a babysitter that has CPR because so many people do.
Anybody can learn, but the Worcester ambulance tells me that only 40% of sudden cardiac arrests are getting bystander CPR when they arrive.
I know some people though. Don't you hear some people see it and they're afraid
Yeah.
to do anything?
They don't think they're the one. They're not confident. They don't have the confidence in their skills. So that's what we do. Here locally. We have a group that trains everybody at high schools, Worcester Public Schools. Everybody gets trained every year.
By the American Heart
7 through 12.
Association?
They partner with us on that. In fact,
Okay.
we're doing a big event at South High School on Friday to celebrate that.
But you must do that all over the state, those kind of programs.
We're trying to do that all over the state.
Yeah.
Something like 40 states in the country require it. Massachusetts doesn't, so we have to go school by school and get
Massachusetts doesn't require
does not require CPR.
CPR training for
For
teachers?
students, for
For
students.
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 And
We're
how
trying-
many states
We're
do?
trying to train a whole generation of lifesavers,
Right.
and that every year another generation is another class is turned out. Massachusetts cannot pass that law, so they can't mandate requirements like that to schools. So we get out and train them. We get out and through high schools and colleges train as many as we can, so that one, people know how to apply CPR skills, and then also they know to send for an AED because that's an important part of the equation.
How young can you start someone training? Like, could Alicia's daughter, who's 6, is she too young to learn how to
No.
do CPR?
No, she's probably too young to apply the compressions effectively. But when we do events when there are 6-year-olds or kids there, we let them train because they can then train an adult in an emergency.
Oh, that's a good point.
They can say, "Hey, I know how to do this. I'll show you." And an adult with the strength can effectively do it because someone there knows how to do it. Like anything else, if the kids know how to do it, they have an impact.
Yeah, it's amazing. Just like when the little tiny kids can, like 3 years old, dial 911 and save a life. Yeah. So, have you ever thought about having your daughter? I'm sure your husband maybe. Does he know CPR?
He does not actually, and we did talk about attending a CPR class.
Yeah, it makes
so,
sense.
Yeah,
Yeah.
it absolutely does.
So you said, Alicia, that you're part of a group that Blair runs. I think he said it's about 15, right? Of people, a meeting to talk about. It's kind of a therapeutic discussion. Everyone has some issue with their heart, and how is it helpful for you?
Oh, absolutely. It's not only helpful for me, but also it's really for a great cause, because whether it's affecting us or our family members, our friends, and other people that just need to be educated more and understand that one little sign that is indicated, you can prevent somebody from having a heart attack or a stroke. So it's the education part of it that we're really driving on our, within our group, is to see how we can outreach to businesses, local businesses and schools and friends and family to participate in some really great information to save some lives.
Okay, so I do want to bring up a couple quick things because we're going to talk about 2 events coming up as we wrap up. But I just want to, I don't know if I'm the only one that didn't know this, but I didn't know that the soap opera actress Susan Lucci, who many people know, who's on All My Children, she has a piece she wrote on the American Heart Association page. And I'm trying to find the quote that I had here because she was talking about she went through something very recently, and here's someone who is not overweight. She says, I exercise all the time. I have no history of heart disease in my family. Well, no, her father did. But she had never had an issue with her heart prior. And I think she's, I don't want to get the age wrong. She's up there, though. I mean, she's older than, I want to say she's maybe 70 or in her late 60s. But she kept putting it off. She kept saying, writes that she thought it was her bra was on too tight. She got a new bra. It's on too tight, so I'm getting, feeling the squeezing in my chest. Or I look pale, so I better put on more makeup. And she's quoted saying, "We're not on our own to-do list." And I think that's an important thing. I don't know, Blair, if you would agree, the difference between men and women. Sometimes women, because they're holding down the fort, and you had mentioned about how they have to run the household and they kind of leave themselves to be last, which we hear a lot. But when she says it like that, we are not on our own to-do list. So when I make lists every day. So maybe when we make lists of what we have to do today, drop the kids off, pick up the groceries, do this, make sure you put in time to work out or whatever. Now, she was lucky because she did have the same symptoms, but she was with a friend who was a nurse in a store. Long story short, got to a doctor, did a procedure. She was 85% had an artery clogged, and had she not gone in at that point, she would have passed away eventually or had a heart attack, been in serious condition. They did surgery, and she was out within 24 hours. So, that just says, it's not just about celebrities. Alicia, you're here. It's every day. But it's also celebrities. People just keep saying this isn't a big deal. So we have two big deal events that are coming up. One is on March 2nd, right? The American Heart and Stroke Association.
Ball, right?
It's the ball, and it's at Mechanics Hall on March 2nd?
Yeah, Mechanics Hall, March 2nd, Saturday night, 350 people. We honor some of the top physicians in the area and have some fun, band and dancing.
Are tickets
prizes.
Available for that?
Yes, tickets are available. They're on the website. It's centralmassheartball.org. And
we'll put that online.
Yeah, and they can learn more about the event there as well.
Okay, and then they ask everybody quickly to bring a ball?
Yeah, so every year we ask everybody to bring a ball to the ball. St. Vincent Hospital sponsors that, and people bring playground balls, and then we go after the event and donate them to local schools that really appreciate it because they just don't have the budget for new playground balls. And St. Vincent Hospital has been very generous in supporting that, and I think we distributed something like 200 new playground balls last year to a dozen schools in the area.
Okay, and then we have time to plan because, and I hope I can get on the team, May 11th is the Central Mass American Heart Walk.
Yes.
Right? And that's at Lake Park, where a lot of the walks are, on Lake Quinsigamond in Worcester, but you can come from anywhere. I mean, there is going to be one in Boston, but anywhere in between, you can do both walks if you want.
Right.
And you can go online for that as well. That you can go to the regular American Heart Association site for that, the Massachusetts, and we'll post that. And Alicia, your doctor, I told you didn't even know this when you came in, that she's actually she's the chairperson of the walk.
I'm not surprised.
Right, I was going to say, after you said everything, you got the right person.
I'm lucky.
Yes, so I'm so glad that you both came in today because I think it's important for people to hear. Hopefully it was helpful for you to get your story out because when you talk about education, this is a good way to do it. Hopefully people that are listening to the show, and I say it all the time, if we affect just one person listening that may be out and see somebody in trouble, instead of taking pictures or walking away because they're scared, they might have heard the show and said, you know what, I'm going to call 911, but I'm going to start compressions. I'm going to do it to Staying Alive, the song. Okay, everybody, I want everybody who's listening to the show to go hear it if you haven't heard it. But any song, that gives you the right beats per minute. Just sing it and you compress on the heart. And you can't do anything, if you push too hard, obviously you could break a rib, but you're not going to do anything. You can't do any damage, right?
No.
You're not going to do any damage.
If
So
their heart stopped, all you can do is help.
So we don't want people to walk away. We want them to, and if you have a story, come forward. So the Central Mass Heart Walk is May 11th, and we have the Heart and Stroke Ball coming up at Mechanics Hall on March 2nd, and we will be posting those websites on our site after the show airs. So thank you to Alicia Bousquet-Taraziak. I appreciate it. And Blair Young from the American Heart Association. Thank you so much both for coming in.
Thank you.
And I know
Thanks for having us.
you bet. And I know it's Heart Month, but let's make every day Heart Month, right?
Yes.
Yeah.
Yep.
All right. Well, with that, that's Community Conversations. I'm Vicki Green. Have a wonderful red day.